Acupuncture is a traditional Chinese medicine technique that has been practiced for centuries. It is a holistic approach to health and wellness, focusing on the body's natural ability to heal itself. This ancient practice has gained popularity worldwide due to its effectiveness in treating various ailments and promoting overall well-being. It involves inserting thin, sterile needles into specific points on the body, known as acupuncture points. These points are carefully selected based on the patient's condition and the desired therapeutic effect. The needles are typically left in place for about 20 to 30 minutes, during which the patient may experience a sensation of tingling or warmth. Acupuncture has been practiced for thousands of years, with its origins tracing back to ancient China. Historical records and archaeological findings suggest that acupuncture was used as early as the Shang dynasty, around 1600 to 1100 BCE. Over the centuries, the practice has evolved and spread to various parts of the world, adapting to different cultures and medical systems. It aims to restore balance and promote natural healing by addressing the root cause of the problem rather than just alleviating symptoms. Many patients find acupuncture to be a relaxing and rejuvenating experience, often reporting a sense of calm and well-being after a session. The serene environment of an acupuncture clinic further enhances this therapeutic effect. Acupuncture is based on the concept of Qi, pronounced Qi, which is considered the vital life force or energy that flows through the body. According to traditional Chinese medicine, Qi is essential for maintaining health and vitality. It is believed that a harmonious flow of Qi ensures the proper functioning of the body's organs and systems. Qi flows through pathways in the body called meridians, which are like rivers of energy that connect different parts of the body. There are 12 primary meridians, each associated with a specific organ system. By stimulating acupuncture points along these meridians, practitioners aim to regulate the flow of Qi and restore balance within the body. When Qi flow is blocked or imbalanced, it can lead to pain, discomfort, and various health issues. Common conditions treated with acupuncture include chronic pain, migraines, digestive disorders, and stress-related ailments. An acupuncturist will conduct a thorough assessment to diagnose the underlying cause of the imbalance and develop a personalized treatment plan. Acupuncture aims to stimulate these points and restore the flow of Qi, thereby promoting healing and relieving symptoms. Many patients report significant improvements in their condition after just a few sessions. The gentle yet effective nature of acupuncture makes it a valuable addition to both conventional and alternative medical treatments, offering a pathway to holistic health and well-being. Qi is the vital energy that flows through our bodies. It's essential for overall health and well-being. Meridians are like rivers or channels that carry Qi throughout the body. These meridians connect different organs and systems. Acupuncture points are specific locations along these meridians. By stimulating these points with needles, acupuncturists can influence the flow of Qi and restore balance. Acupuncture is widely recognized for its effectiveness in pain management. This ancient Chinese practice has been used for thousands of years to treat various ailments, and its popularity continues to grow in modern medicine. By inserting thin needles into specific points on the body, acupuncture aims to balance the body's energy flow, known as Qi, and promote natural healing processes. It can help relieve various types of pain, both acute and chronic. Whether you're dealing with a recent injury or long-term discomfort, acupuncture offers a holistic approach to pain relief. Conditions such as back pain, arthritis, migraines, and even menstrual cramps can be alleviated through regular acupuncture sessions. Many patients report significant improvements in their pain levels and overall well-being after just a few treatments. Acupuncture is believed to work by releasing endorphins, which are natural pain-relieving chemicals produced by the body. These endorphins act as natural painkillers, helping to reduce the perception of pain and promote a sense of well-being. Additionally, acupuncture can stimulate the release of other neurotransmitters and hormones that play a role in pain modulation and stress reduction. It also helps by reducing inflammation, calming down inflammation, which often contributes to pain. Inflammation is a common cause of chronic pain, and by targeting the inflamed areas, acupuncture can help to decrease swelling and promote healing. This makes it an effective treatment option for conditions like tendinitis, bursitis, and other inflammatory disorders. Additionally, improving blood circulation, increased blood flow to the affected area can promote healing and reduce pain. Enhanced circulation ensures that oxygen and essential nutrients are delivered more efficiently to tissues, aiding in recovery and reducing discomfort. This improved blood flow can also help to remove toxins and waste products from the body, further supporting the healing process. Overall, acupuncture offers a comprehensive approach to pain management, addressing both the symptoms and underlying causes of pain. Acupuncture can be helpful for a wide range of conditions. It is often used to treat back pain, alleviating pain caused by muscle tension, herniated discs, and other spinal issues. It can also relieve neck pain and stiffness due to poor posture, stress, or injury. Acupuncture can reduce the frequency and intensity of headaches and migraines. It can also help manage pain and improve joint mobility in conditions like osteoarthritis. Numerous scientific studies support the effectiveness of acupuncture for pain relief. Research has shown that acupuncture can be as effective as, or even more effective than, conventional treatments for certain conditions. For example, a large review of studies published in the Archives of Internal Medicine found that acupuncture was effective in treating chronic pain, including back pain, neck pain, and osteoarthritis. Acupuncture is generally safe when performed by a qualified and licensed practitioner. These professionals undergo extensive training to ensure they can provide the best care while minimizing any potential risks. Their expertise is crucial in making sure the procedure is done correctly and safely. However, like any medical procedure, there are potential risks and side effects, although they are usually mild and temporary. It's important to be aware of these so you can make an informed decision about your treatment. Understanding the risks helps you weigh the benefits and make the best choice for your health. Some possible side effects include soreness or bruising at the needle insertion sites, which is usually mild and goes away on its own. This is a common reaction and typically resolves within a few days. It's similar to the soreness you might feel after a workout or a minor injury. Minor bleeding can occur, especially if you are taking blood thinners. This is because blood thinners can make you more prone to bleeding. If you are on such medication, it's important to inform your acupuncturist so they can take necessary precautions to minimize this risk. Additionally, some people may feel tired after an acupuncture treatment. This fatigue is usually short-lived and can be a sign that your body is responding to the treatment. It's often recommended to rest and hydrate after your session to help your body recover and maximize the benefits of the treatment. It's always a good idea to discuss any concerns or pre-existing conditions with your acupuncturist before starting treatment. This allows them to tailor the session to your specific needs and reduce the likelihood of adverse effects. Open communication is key to a successful and safe acupuncture experience. Ensuring that the acupuncture environment is clean and sterile is also crucial. Licensed practitioners follow strict safety protocols to prevent infections and other complications. They use disposable needles and sanitize their equipment thoroughly, which significantly reduces the risk of infection. Despite these potential risks, many people find acupuncture to be a beneficial and relaxing treatment. The key is to choose a qualified practitioner and to communicate openly about your health and any concerns you may have. With the right approach, acupuncture can be a safe and effective part of your wellness routine. It's important to find a qualified and licensed acupuncturist to ensure safe and effective treatment. Look for an acupuncturist who is licensed in your state, as this ensures they have met the necessary education and training requirements. Ask about their experience and success rates, especially in treating your condition. Choose an acupuncturist you trust and feel comfortable with. And, of course, make sure the acupuncturist uses single-use, disposable needles. Acupuncture can be used alone or in combination with other therapies, such as massage, physical therapy, or conventional medicine. Integrating acupuncture into a comprehensive treatment plan can enhance its effectiveness and provide a holistic approach to pain management. Acupuncture is a safe and effective approach to pain management. It can provide relief from various conditions, from back pain to headaches. By stimulating the body's natural healing abilities, acupuncture offers a drug-free option for pain relief. If you're seeking a holistic approach to managing pain, consider exploring the potential benefits of acupuncture.